How does bilirubin cause sickle cell gallstones? Have you ever wondered how bilirubin is linked to gallstones in sickle cell disease? Let's break it down. In sickle cell disease, the body experiences chronic hemolysis, which is the ongoing breakdown of red blood cells. This process leads to the production of excess bilirubin, a yellow pigment that forms when hemoglobin is broken down. Normally, the liver processes bilirubin and excretes it into bile. However, in sickle cell disease, the levels of bilirubin can become too high. When there is too much bilirubin, it can combine with calcium in the bile to form calcium bilirubinate crystals. These crystals can then aggregate and develop into pigment gallstones. This is a common complication for those with sickle cell disease. The cycle begins with the destruction of sickled red blood cells, which releases a large amount of hemoglobin. The body metabolizes this hemoglobin into unconjugated, or indirect, bilirubin. Under normal circumstances, the liver converts this bilirubin into a water-soluble form. This conversion is done by an enzyme called UGT1A1. However, in sickle cell disease, the amount of bilirubin produced can overwhelm the liver's ability to process it. Additionally, mutations in the UGT1A1 gene can further hinder this conversion, increasing the risk of bilirubin precipitation. Once in the bile, the excess unconjugated bilirubin binds with calcium ions. This creates insoluble complexes known as calcium bilirubinate. These complexes can crystallize and form black pigment gallstones, which are different from the cholesterol stones that are more common in the general population. Gallstones can accumulate in the gallbladder and biliary tract, leading to potential blockages, inflammation, and pain. Other factors can also contribute to gallstone formation. For instance, genetic predispositions, chronic inflammation, and the presence of biliary sludge, a mixture of mucus, calcium bilirubinate, and cholesterol can all play a role. Biliary sludge may even precede the development of gallstones. Research indicates that the frequency of gallstones in patients with sickle cell disease is significantly higher than in the general population. Studies show that up to 25% of individuals with sickle cell disease may develop gallstones, particularly in adolescents and adults. In summary, bilirubin causes gallstones in sickle cell disease primarily due to chronic hemolysis, which leads to excessive bilirubin production. This, combined with impaired bilirubin processing and the formation of calcium bilirubinate, results in the development of pigment gallstones. Managing gallstones is crucial for individuals with sickle cell disease to avoid complications like biliary obstruction or acute abdominal pain. Always consult a healthcare professional for personalized advice and management.